I mean, جزاكم الله خير. بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد خاتم الأنبياء والمرسلين. I really have the great honor to introduce Dr. Hassan Chamsi Pasha. MashaAllah, I know he's very well known and he's beyond to introduce him, but it would be really fair just to mention a few words before we start our new series for the History of Islamic Medicine series of the Federation of Islamic Medical Associations, which we've been running for the last few months. Dr. Hassan Chamsi Pasha is a consultant cardiologist in Jeddah. Formerly, he was working as cardiologist in King Fahd Armed Forces in Saudi Arabia also. Dr. Hassan is very well known on publishing many books, mashallah, and articles. He had over probably maybe 65, 67 different books on health education, on medical ethics, and on Islamic health guidance as well. He was the author of the very famous book on the Contemporary Bioethics, Islamic Perspective, which is published a few years ago in English. He is also a member of the board of directors of the Saudi Heart Foundation. This is actually almost for 10 years, between 95 till 2005. He's currently a member of the editorial board of several medical journals, and also he's a counselor to the International Islamic Fiqh Academy since '92, and he's interested in the field of medical ethics. Dr. Hassan, mashallah, he produced many TV shows as well, has been interviewed many times in a different TV channels, and he gave many talks as well in English as well as in Arabic. I'll hand it over to Dr. Hassan, and we're really looking forward to hear about the Islamic medical ethics from mainly, we're hoping as well to get touch on the historical side, and I'll leave it to him, please, to start. Jazakallah khair, Dr. Hassan.
بسم الله الرحمن الرحيم والصلاة والسلام على سيد الخلق والمرسلين. Good evening, ladies and gentlemen. Thank you very much indeed, Professor Sharif, for this nice introduction, and congratulations for the professorship you just had recently. You deserve it. I think I will start now screen. I think sharing a screen. Still host disabled participant screen. Can somebody let me share the screen, please? Yes, that's okay now. I think I'm okay. We need, this is the lecture. Okay, then. Thank you very much. I think we are home and dry. Bismillah ar-Rahman ar-Rahim. I've been asked actually by Professor Sharif to give this topic on Islamic contribution to medical ethics. And I think I will try to do my best in summarizing or highlighting the contribution of Islamic medical ethics. Now, we know actually that the impact of Islamic civilization on the Western science and medicine in the era between 19th and 13th century is not well remembered by many in the West, unfortunately. And we know during that period, many Muslim scholars and doctors were building on the work of Greeks and Romans and making discoveries that continued to influence medical practice for several centuries. This is actually a nice article published in 2007 in Canadian Medical Association Journal, and the title is very clear: Islam's Forgotten Contribution to Medical Science. And what it says actually that many Western historians underestimate the contribution of physicians of the medieval Islamic world, and they usually are perceived as simple purveyors of the Greek science to the scholars of Renaissance. And this fact is completely wrong. It's not actually a fact, it's really a fake. And I will show you evidence for that in a moment. Just talking about the contribution in medical ethics led down the contribution in other parts of medicine and surgery, etc. Now, this is a nice paper in the BMJ in 2005, How Islam Changed Medicine, and they quoted King William saying that buildings in Andalusia are reminders of the architectural imprint of the Islamic civilization. But less well remembered is the impact of this civilization on Western science, technology, and medicine between the years 800 and 1450. And until a couple of centuries again, Arabic, we know that for a fact, was the medium of communication throughout the Muslim world, regardless of the type of activity, whether it's religious, social, or scientific. And during that period, essentially most of scientific works were written in Arabic. And it's only until colonization of the Muslim lands when actually this practice changed. Lawrence Conrad, in the Companion Encyclopedia of the History of Medicine, has written clearly that the language of the Arabs became the common cultural denominator of the medieval Middle East and was spoken as the lingua franca, but not only Muslims, but even Christians and Jews as well. Now, many historians claim that the Western world pioneered the setting of ethical, legal, and professional standards in medicine, and some even propose that the medical consent, is an American invention, and will show that this is not true later on. Others claim that patients' rights and legal protection proposals have been stated in the early decades of the 20th century. Now, we know these two persons very well for everyone working on medical ethics, Beauchamp and Childress, who in 1979 published this famous book on principles of biomedical ethics, and they actually concentrated on these four principles of ethics: the autonomy, beneficence, non-maleficence, and justice. And we will show that actually these have foundations and roots in Islamic culture and Islamic Sharia. Now, the concept of bioethical principles has since 1979 considered as purely Western innovation, and it's absent in Islamic healthcare system. And this is not true. The Islamic medical ethics also upholds the four basic principles. There is no question about that. And the Muslim physician should make a decision in the best of interest of the patient, whether Muslim or non-Muslim, and without imposing his or her religious views on the patient. Now, these bioethical principles, the four I mentioned, have been legitimized by Muslim jurists as falling into the sphere of the Islamic law and have been supported by Quranic verses and tradition as well. There are, of course, many differences in the details, particularly in the autonomy principle. Now, we know bioethical deliberation is inseparable from the religion itself. We're talking about Islam, which emphasizes continuities between body and mind, material and spiritual realms, and between ethics and jurisprudence. And of course, the Islamic bioethics is an extension of Islamic law, which is based on the two foundations, the Quran and Sunnah. Excuse me. In the Quran, many terms describe the concept of ethics. We have khair, the goodness, maslaha, public interest, birr, righteousness, qist, which is equity, adl, equilibrium and justice, haqq, which is truth and right, ma'ruf, and so on. All of these actually are in the basic principles of Islam, and they are in the basic concepts of ethics. Above all, the Quran commands Muslims to not to do any good only, but also to forbid evil's action. And for Muslims, being rational does not mean only to justify things intellectually, but also to examine every single aspect of moral conduct to determine whether such behavior aligns with the Islamic law or not. Now, one of the major principles and incentives in Islam for any health professional worker, not only doctors, nurses, technicians, anyone working in medicine, for this ayah or this verse, if anyone saved a life, it would be as if he saved the lives of all mankind. 8 billion people, saving 8 billion people. And this, as I said, does not apply only to physicians. It applies to the nurse looking after the patient, to the technician looking after the patient. And we've just seen in UK, the nurse who killed 8 newborns. So this actually applies to everyone in healthcare system. There is another hadith, which is very famous, and that encouraged people to take medicine and to be treated. And God said, our Prophet Muhammad said, Allah has sent down both the disease and the cure. He has appointed a cure for every disease. So treat yourselves medically, but use nothing unlawful. There is another major principles in medical ethics, to do things in a perfection way. And this is actually a hadith of Prophet Muhammad. Allah loves someone who, when works, he performs it in a perfect manner. And this is actually very important, again, for any health worker facing patients every day. Another incentive for doctors and nurses, again, this is actually, we all go every morning to see patients in the ward rounds. But many of us, unfortunately, do not have the intention that they are visiting that patient. And the Prophet Muhammad says, he who visits the sick continues to remain in the fruit garden of paradise until he returns. So if you go in the ward round in the morning and visit the patient, this is, if you make the intention that you want actually to relieve the patient's harm, to put a smile on his face and to give him some hope, this actually, you are living in the paradise during that time until you return back. There is another hadith also says that when you do that in the morning, 70,000 angels will send the blessing upon that person until the evening, and the same thing if it is done in the evening. One can easily find all these universal principles, the 4 ones which I mentioned, not only in the Holy Quran, but it among the saying of the Prophet Muhammad, and also in the teaching of many great Muslim scholars throughout the history. Let's start with autonomy. Now, autonomy means, of course, self-rules. And we know in Quran that there is no compulsion in religion, and that actually each person has the full will to accept Islam or refuse it. Whoever wills, let him believe, and whoever wills, let him disbelieve. And the Quran said to the Prophet Muhammad, will you, Muhammad, then compel mankind until they become believers? So that actually, this autonomy principle is the base of Islamic Sharia. Now, of course, there are there are religious morality which is not compatible with the human freedom and responsibility. Now, we cannot do everything according to our wish. There are limits, of course. We cannot, I want actually to change my sex, for example, as it is happening nowadays. I cannot do it because there are, of course, limitations to this type of autonomy. And now we see the dangers and the problems occurring with these people, the transgenders, when we see that 40% are having either suicide or suffering severe depression, and so on. Now, Islam does not permit man to act as he wishes, but limits him with certain rules. I cannot ask for mercy killing just because I fed up with life. Of course, there is limits for such type of autonomy. Now, the beneficence is so intimate to the principle of non-maleficence. And we know that beneficence implies the acts of mercy, kindness, charity, altruism, love, and humanity. And these are all in the roots of Islam, in many hadith and many verses in the Quran. Beneficence in the Islam is plenty of ayahs and hadith are talking about this. And the one of them, actually the Quran says, so whoever does good equal to the weight of an atom, even the weight of an atom, which is so minute, shall see that effect. And whoever does evil equal to the weight of an atom shall see that in the hereafter. So this is actually the major principle. And the Prophet Muhammad says in a famous hadith, the best of you is the one who is most beneficial to others. The best of you is not the one who does so many rak'ah. Is the best of you is the one who is most beneficial to others. And he also says, whoever can do anything beneficial to one of his brothers, he should just do it. The other concept or principles of the modern bioethics, the non-maleficence. And the Prophet Muhammad said that in 2 words, la darar wa la dirar. There should be neither harming nor reciprocating harm. You should not injure yourself, or you should not injure other people as well. I lost the screen now. I don't know what happened. Okay, I will go back to it. Yes. Okay. So it's amazing to find in the sayings of Prophet Muhammad, ordering Muslim do and promote good, remove evil or harm, and prevent evil or harm. These are all in the Prophet Muhammad hadith. I can give you so many of them. And one of the major axioms in jurisprudence, avoiding harm takes precedence over bringing good. جلب المصلحة مقدم على دفع المفسدة مقدم على جلب المصلحة. And the first thing is to thwart off the harm. And this is actually very clear in Islam. Justice, the 4th principle, and many verses in Quran, almost 16 ayah, talking about justice. And it is actually even the purpose of sending the prophets, as God said, is to establish justice in the world. Indeed, we have sent our messengers with the clear proofs and reveal with them the scripture and the balanced justice that mankind may keep up justice. Justice is a comprehensive term and may include all virtues of philosophy, and Islam asks for something even warmer than justice, which is returning good for ill. Idfa billati hiya ahsan. Now, it is fair at the end of this part of my lecture to say that the roots of these 4 principles of bioethics are present in Islamic teachings. Of course, there are some differences particularly in the understanding of autonomy. And this is certainly there between the Western and Islamic ethics. Now, when we come to medical responsibility, the Prophet Muhammad summed it up in one hadith. If someone practices medicine and he has no knowledge in medicine, he is responsible for his act. So this is a clear cut. And this is actually this consent and liability. We have actually seen that clearly in many books and in many scholars' books written on that subject. Now, one of the first books written on Prophet medicine by Abdul Malik ibn Habib, and that's an Andalusian doctor and physician. He actually stated clearly in this book that to practice medicine, the practitioner should be licensed by the muhtasib. We'll talk about that in a moment. He should obtain the consent of the patient. If he has not fulfilled one or both, then he is liable. And we read also things about medical ethics in the Prophet Medicine book written by Ibn Qayyim al-Jawziyah. He actually talked about the human behavior and ethics. He actually mentioned that the physician should be well-trained and keen on getting his job carried out in the best way. Now, licensing started in the Islamic history way back to 931, when the Khalifa al-Muqtadir learned that a patient died as a result of physician's error. He orders his chief physician, Sinan bin Thabit ibn Qurra, to examine all those practicing medicine at that time. And in 1 year, he examined and licensed 860 physicians in Baghdad alone. Now, the muhtasib, the concept of ihtisab or hisba, is actually peculiar in Islam, and it does not apply only to medicine. It applies to trades and every single act in Islam. Licensing boards were set up under the government official muhtasib or inspector general, who monitors the qualification, the exigent legal standard in Arabic medicine. And after 1,000 years, we found the licensing of physicians started being implemented in the West, such as stated licensing board in medicine and surgery and so on. Now, it is possible that Al-Ma'mun and Al-Mu'tasim initiated in Baghdad, what they initiated in Baghdad for the Al-Husba principles and incorporating that in the government system, it paved the way for the first government enforcement of ethical codes for the health professionals. And there are several papers published on the Hisba in Islam and health system, one of them written by Sami Hamarna and the other one here by Shahabuddin. Now, several books were published in Hisba in Arabic, and among them, this one is a famous one, which is written by Shazari, Abdurrahman Shazari, who died in 1094. Now, this book, actually, there is a chapter 37 in it. It's involving only Husba on physicians and surgeons, etc. And what actually we found that the system is Hisba was first brought to the attention of the Western world in 1860 by Walter Bernard. Now we come on to the famous books written on Islamic medical ethics. With Dr. Al-Bar, I've written actually an editorial a few years ago on Islamic medical ethics 1,000 years ago, and focusing on two major books which are fully devoted to medical ethics. And this is really amazing, which is written 1,000 years. The first one written by Ishaq al-Rahawi, and the second one was written by Abu Bakr al-Razi. And these famous physicians as well, They both written the earliest and most thorough books on medical ethics, as I said, and they both build their knowledge upon themes from the Hellenistic medical tradition, but they incorporated that with the Islamic traditions. Now, this is actually Adab al-Tabib by al-Rahawi, is one of the famous books written on this subject. He is a Christian and who probably embraced Islam. Al-Rahawi actually was contemporary to Abu Bakr al-Razi. Both lived in the second half of the 9th century. And this book was translated into English by Martin Levy in 1967. Our moderator and Dr. Sharif Al-Kaf Al-Ghazal, he wrote actually a very nice paper in 2004, and he focused on this book of Ishaq Al-Rahawi and the other one, Fardos Al-Hikmah. He actually summed up the titles of the two chapters of Adab al-Tabib. And look at these actually titles: that care of physician's body, what the physician must avoid and be aware of, the directions of the physician to the patient, manners to the visitors or visitors, etc., etc. And these actually 20 chapters in one book written 1,000 years ago on medical ethics. Another paper which was published almost 10 years ago, talking about the medical ethics in medieval Islamic science and focusing again on this book, Adab al-Tabib by al-Rahawi. And this book contained extensive instructions on mutual respect and moral obligations of the physicians, nurses, patients, and other staff. He concentrated also on that mental health is the most important part of health, and its violation can result in physical health. This important concept of psychosomatic medicine, which is famous now, and all these values, moral values which we called for, are actually present nowadays. These ideas still maintain their validities nowadays and are laid down in several ethical codes of medicine. Excuse me. Now, we cannot ignore that al-Rahawi quoted Aristotle, Socrates, Galen, and Hippocrates to support these ideals. But he used, as I mentioned, Islamic traditions as well to further support these points. And we know that actually a distinguished Islamic paradigm, that any knowledge considered part of the culture of humanity and does not contradict Islam should be accepted as a mercy from God. The second book, Akhlaq al-Tabib, which is written by Abu Bakr al-Razi, and this presents also the first model for ethics in Islamic medicine. And he actually felt that it was important not only for the physician to be an expert in his field, but he has also to be a role model. His ideals on medical ethics were divided into three concepts: physician's responsibility to patients and to himself, and patient's responsibility to the physicians. The first thing is duties to himself. The physician has to continue getting medical education. He should be virtuous. He should have the dedication, and he should look after his appearance and be in a nice way. The physicians, of course, has duties to the patients, to be kind to the patients, not to be aggressive, to be soft-spoken, compassionate, and behave modestly, to encourage patients and put hope. Even if the patient has hopeless case, he still has to instill some hope, and that's actually in the Prophet teaching as well. And this is actually to inculcate positive ideas into the patient, I beg your pardon, to insert positive ideas into the patients and to instill that it is an important method in the modern psychology. And he also stressed the importance of treating patients equally and not to go for money, to cure the poor and homeless rather than the rich people. Physicians will be more careful. Physicians should be more careful when they are treating women. And he quoted Galen's sentence, physicians must adhere to God's. Sincerely, he should only look at what he has to look there. Now, of course, there are duties of the patients to the physicians, that they should treat the physician kindly and to talk gently with the physician. Al-Razi supports Hippocrates by quoting, find your physician and prepare him before you need him. He attacked the charlatans and the fake doctors, and he said that physicians, of course, must depend on Allah rather than depending on themselves for the cure of the patient. Another famous book, Dr. Sharif Kafr al-Ghazal also referred to in his article, this book actually Furdus al-Hikmah, which is published by Abu Hassan Ali ibn Rabban al-Tabari. And this actually book has several chapters, and he actually stated the obligations toward the patients. He also talked about obligations toward the community, towards colleagues, assistants, and so on. And this book was printed in Berlin by Professor Edward Brown in 1928. There is another book for al-Tabari, Abu al-Hasan al-Tabari, called Mu'alajat al-Buqratiyya. And this is a nice paper published almost 10 years ago, reviewing the views of Abu al-Hasan al-Tabari and stating that this book, Mu'alajat al-Buqratiyya, it has almost 90 moral points on interaction between the physician and the patient mentioned in this chapter. He actually, the physician should possess the following virtues: to forgive wrongs, to counsel when he doesn't know, and to be honest, merciful, and upright. All these principles are stated almost 1,000 years ago clearly. The physician should not be late, should be punctual, should avoid wrangling about fees, and should be thankful to no matter how much he is paid. And these principles, particularly with contentment, will make him more respected among his clients. Another physician, Ibn Abi al-Ash'ath, the one who actually talked about the physiology of the stomach. I will talk about that in another lecture, but he also talked about standards in medical ethics. And he warned about against indifference. This is very important. And he also warned against charlatans and fake doctors and ignorant quacks, as now we see many of them on the internet, unfortunately, are not fit to practice an art of whose doctrines and teaching they are unaware of. Ibn al-Ash'ath, this is actually from Encyclopedia of Islamic Encyclopedia, written by Remy Krook. And then we talk about another person, Ali ibn al-Abbas al-Majusi, or Hali Abbas. He also talked about ethics of medicine in the book called The Perfect Art of Medicine, Kamil al-Sina'a al-Tibbiyya. And he actually stated so many things. I don't have the time to talk in details about everyone, but this is another person, Ibn Batlan. He's an Arabic Christian physician and philosopher. And he actually demanded high ethical standards for physicians. And he said that these physicians should have sound judgment and moral courage, not only learn in medicine. It is up to the doctor to justify his high calling through his actions and professional dignity. And if the physicians are always efficient and worthy of their high calling, of course, the public will be more appreciative and honor the healing art. Unfortunately, now we see many attacks on doctors and some accuse doctors of lacking some ethics, when some, unfortunately, few doctors, maybe everywhere in the world, we see that they are actually like money, and they search for money everywhere, and other things which I think we can allude to in another lecture. This is actually on Ibn Batlan, written by Lawrence Conrad in the encyclopedia as well. And he actually put this book called Da'wat al-Atibba, Call for Doctors, and this involved actually a nice Arabic literature. And he says, when I should die and go to my grave, no one will mourn or my vigil keep, save my medical comrades and books. All of these will be left to weep. In another book called Tashwiq al-Tibbi, written by Saeed ibn al-Hassan, he also had a third chapter there, and that's actually on ethics. And he stated that the physician should be faithful and diligent and so on, and she should be well trained. He should answer questions when he's asked and seek more information. He should avoid pride and attempt accurate prognosis, etc., etc. So many calls for medical ethics. This is the book. Another book actually, an Ibn Salloum al-Halabi, غاية الإتقان في تدبير بدن الإنسان. This is also talking in it on ethics. Al-Jawbari also criticized frauds in the 13th century, and those actually, he called them highway physicians, أطباء الطريق, who roamed everywhere, and they actually tried to cure or pretend to cure diseases and give medicines without knowledge in such thing. Now, it's interesting to see actually this 450 years old Turkish poem, almost 68 lines on medical ethics. This is actually published in Journal of Bioethics Inquiry in 2017. 68-line poem on the medical ethics and ethical art, almost actually 450 years ago. Now, the last part of my talk will be on clinical records, informed consent, and litigation. Now, we know that the practice of medical record keeping dates back to the 5th century BC, and that was when it was dominated by Hippocrates and others, and these actually were there. But it was not until the 20th century when clinical records were routinely used as a tool to assess the quality of medical care, to educate physicians, evaluate the outcome, and so on. And it was assumed that the clinical records were not used as legal and educational tool before the middle of the 19th century. But in Arabic, we found, with the presence of availability of paper, printing, and HIM-FIMA system, medical records were incorporated in the medical practice many years ago. As we've seen, actually, the set of rules for medical exams for health workers, a set of rules were also regarding patients' care were introduced, and a copy of those records were sent to the patient's relative. After the physician sees the patient, he will give a copy of these records to the relatives. And then he actually will write a progress report on daily practice when he is reviewing the patient on the following day and the third day and so on. And he repeats that every day until the patient recovers or la samahallah dies. If he recovers, he will get his fees and bonus. If, on the other hand, the patient dies, the second or next of kin will go to Hakim or a well-known physician, showing him copies of these, what's written by that doctor. If this Hakim find that these were complying with the medical rules and what actually is established at that time, he will tell them that nothing wrong. If he finds on the otherwise that there is some negligence on the part of the physician, he will tell the relatives that you have to claim damage for the death of your relative. Dr. Al-Ajluni believed that this review of records by the chief physician after death occurs, if death occurs, represent the post-mortem examination of the outcome of therapy by a peer and maybe the first documented reference to the practice of peer review. Now we move on to the informed consent. And the first informed consent, we can say that it was by the Prophet Muhammad in Islam. During his last illness, he asked his wives not to force medicine in him if he gets leprosy through the side of the mouth, but they did against his wish. And when he came round, he ordered them to take the same medicine in the same way given to him. Each one of them did the same with the other. And this illustrates that consent of the patient is essential even if the condition is serious. This not only represents informed consent, but it represents also advanced directive, which is a new concept incorporated in the Western medicine, of course, in the last decades. Now, little evidence that formalized practice of legally binding informed consent existed before the 19th century. Dr. Kamil Ajluni actually published a paper many years ago showing the first legal consent by in Turkey in 1677 for extraction of hernia. And this is actually the informed consent in Turkish, and that's in English. And that's what it says here. And even actually decide everything in front of the Sharia Council and the name and the site of the hernia on the right side, the cost and everything there. And this actually document is witnessed by two persons, and that actually is very, very clear informed consent. And this actually incorporates the things which are required in the informed consents nowadays when we say that it should have adequate disclosure of information, adequate comprehension of this information, voluntary consent, and competence of the patient to consent. So that document, which is 400 years ago, it covers almost all of these. Another paper published in 2006 on the Uthman consent documents, again, the same thing for a patient with urinary bladder disease, and it is stated if his son, the patient actually was a minor, if the son dies because of this operation, the physician or the surgeon will not go to the court for blood money, diya. So that's actually stated clearly. There is another paper which was published in 2007, again on hernia, as you can see there. And in more recently, last year, there was a nice article and a study on surgery and hernia surgery and informed consent in the 17th century in Istanbul. The authors actually used Istanbul Sharia Court registers, and they found 21 informed consents there regarding hernia surgery only. And they found 5 surgeons, 21 patients, and these documents actually, or contracts, show that patients were informed about the possible complications before operations, and their permissions were obtained. And contracts clearly state that the blood money from the surgeon would not be requested if the patient dies during or after operation, unless, of course, there is negligence there. So these actually court records protected patients and physicians alike from criminal liability. Again, just about 10 years ago, this is actually Omar Said Liglil. He actually published a paper that there is an older concept which is dated back to 1524, 500 years ago. And this is considered so far is the earliest concept document found so far in the literature. So that was back to 1524, 500 years ago. And again, as I said, although the obtaining consent in scientific research from human beings was considered to have originated from the Nuremberg Code in 1949, this study shows that it was there in 1524. And the last part of my talk in few minutes on litigation. This is a translated documents of a case in which a Muslim patient took a Jewish surgeon to the court for alleged malpractice. And it stated actually here what happened to the patient. Patient went to the surgeon because of wind in his scrotum. And the surgeon inserted the lancet into the scrotum. And what happened that actually blood and pus came out, and 3 days later, the patient died. His brother went to the court and he actually claimed that there was negligence of this Jewish doctor. The judge asked actually witnesses, physicians or surgeons who are skilled in this subject, and they actually testified that this surgeon who did the operation was efficient in this kind of surgery. Excuse me. And they actually stated that this was done in the right way, and the judge ruled that the surgeon cannot be held accountable for what happened to his brother. And the Jewish surgeon, who is skilled in his craft of surgery, has behaved according to the established professional norms. So the case was dismissed. So in conclusion, ladies and gentlemen, it's fair to say that the roots of 4 principles of bioethics are present in Islamic teachings with different emphasis on individual ones. Chronologically, Islamic medical ethics seems to have considerable effects on the initiation and development in European medical ethics. And 2 books, at least, were written in Arabic on medical ethics 1,000 years ago, in addition to many chapters written by different physicians, and have shown that the informed consent is not a Western invention. The original consent document dates back to 1524. Now, finally, I will say, quote, Jonathan Siegel said, "It's good to be a seeker, but sooner or later you have to be a finder. And then it is well to give what you have found, a gift into the world for whoever will accept it." And in fact is the Muslims in medical ethics acquired a lot, and they gave a lot. And finally, we read actually what was published in 2005 by Drabo and others. Today's Western world might look very different without the legacy of Muslim scholars in Baghdad, Cairo, Cordoba, Damascus, and elsewhere. With this, I will stop here and thank you very much indeed for your attendance. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah khairan, Dr. Hassan. Allah yatikum al-afiyah. Thank you very much for a very valuable talk. The comments and everybody is sharing how much they benefit from this. Jazakumullah khairan. الصوت انقطع كأنه يعني.
I can hear
جزاك الله
you.
خير.
نعم.
بارك الله فيك. Really quite a great talk. MashaAllah, fascinating, educational, comprehensive. جزاك الله خير, Dr. Hassan. I'm just going to have a very quick question, if you don't mind, till we see if there's any more questions coming from the chat box. I know medical ethics, you always look at what's the current challenges on the time. I can read a few books in surgery, which is my specialty. And when I read Ibn Nafis on his discovery of the pulmonary circulation, when I read Al-Zahrawi's, mashallah, Tasrif Liman Ajiza an al-Ta'lif, fascinating book, I can see there's no doubt on that time they had to take some challenges. And one of the most challenges actually dissection of cadavers or تشريح الجثث. So my question is, to what extent this really played part? Did they dissect or not? The way the information has been concluded from many surgical books probably may be said, most likely yes. I know some fuqaha, they have different opinions on this. I know the al-darura. So I don't know, how can you please maybe shed light on this, if you don't mind, Dr. Hassan?
Thank you very much. That's an excellent question, without any doubt. Now, we know for sure that actually this section was practiced by some doctors. And Dr. Muhammad Ali al-Bar, my friend and brother, has written a book on ilm al-tashrih, and he incorporated a chapter on the physicians who actually practiced that. So we know for sure that this was actually practiced. And the way Ibn al-Nafis and so on describe the circulation, the pulmonary circulation and so on, as you said, it cannot be done without dissection. So I think that was done. And there are, of course, many scholars say that in certain darura, that if the disease or the patient dies of unknown disease, if there is actually suspicion about a crime, if there is suspicion about some misfortune there, or something actually unusual in the outcome of that patient, I think many authorities agree to having dissection in such case. So there are limited areas not done routinely. And even in Britain, we know that when to call actually for such thing, then of course, we call for that when we are suspicious. I remember in 1981, I was in London and I had a girl who was 14 years old. She died because of swallowing glasses. She had actually about 1 kilogram of glasses she swallowed, and without actually having, without having bleeding. And we called actually at that time, of course, for dissection to find out the cause of this. So I think it has roots in Islam and it is practiced.
Jazakallah khair, barakallah fi. Before I give to Dr. Jalal Najjar, he's one of the neurosurgeons from North Syria. Jazakallah khair. Quick questions being asked. Hal al-Majusi Muslim? Al-Majusi, was he a Muslim?
I think some people say yes. Some people actually say yes, that he is a Muslim. And this is why actually they call him Abu al-Abbas al-Ahwazi rather than al-Majusi. So, and Hali Abbas. So I think there is some doubt about it. But anyway. Yeah.
Dr. Jalal, if you want to unmute yourself, please.
Assalamu alaikum, jazakumullah khair. It's fantastic presentation. See you, Professor Hassan, again.
Thank you very much.
I did not forget your lecture in ethics and medicine in Homs, maybe more than 10 years ago with Dr. Albar. Anyway, last week we had a great meeting in Istanbul, and there's many people from United States and Japan and other worlds. They were speaking about the history of anatomy as an introduction of the neurosurgical meeting. The Japanese colleagues had no idea about the Islamic civilization. And still remark as civilization gap and the big gap. And he was surprised when I explained to him that we had a lot of history which covered as a big lie with the civilization gap. So I certainly want to share with you that it's our responsibility to make it again, to publish it in not in Arabic language, because nobody can read it. I put it in figures, I built it in English in Journal of Neurosurgery in the United States 2010, and with the help of Professor Sharif Kaf al-Ghazal, we reprint more 2 articles in England. For the section of the cadaver, they were surprised that the Arabic scholars mention it perfectly. For example, al-Baghdadi يقول بعد أن شرحت 2000 جمجمة وجدت أن عظم الفك السفلي يتألف من قطعة واحدة وليس من قطعتين كما يقول جالينوس. And Jalinos, he was the main pioneer of them. Nobody can accept that somebody will different his remarks different from Jalinos. The other Al-Razi, he said in his book, لقد أتاني رجل سقط عند ظهر الدابة وهو يشكو من خدر وتنميل في إصبعه الصغير وأنا أعلم أن لديه كسر في الفقرة السابعة لأنني أعلم من التشريح أن العصب من الفقرة السابعة يصل إلى هذه الإصبع. He said that perfectly. So this is our responsibility to make it in other languages to distribute it. And thank you again. Thank you, Dr. Hassan and Dr. Sharif for such an amazing meeting. Thank you.
جزاك الله خير أخي. بارك الله. دكتور محمد عثمان. Please feel free. You just need to unmute yourself if you don't mind. We can't hear you. We can't hear you.
Can you hear me?
We can't. Now we can. If you just please introduce yourself, or I'm sorry.
Hello, hello? No?
Yeah,
no?
yeah. Carry on, Akhi.
Can you hear me now?
Yes, yes,
we
yes.
can.
Oh, okay. Assalamu alaikum wa rahmatullah. I think this is a very interesting talk. I really enjoyed this, Dr. Hassan, and for those who made this platform available. I just want to ask about whether in the history of Islamic history, whether there are any medical research done testing different type of procedure or different type of medicine.
You mean on the medical ethics itself, isn't it?
In the medical ethics itself, or medical research as general.
Let's focus, make the most of Dr. Hassan on the medical ethics, inshallah.
Okay,
I'll leave it to him to answer, Dr. Hassan.
Yeah. Well, I think we cannot say that there is actually formal research like actually what we see at the moment, but I'm sure there is actually principle of research done when they actually compare the management of one patient to another. So I think it's in a way like actually controlled group, but it's difficult to say that there is exactly what in fact we are practicing nowadays when we have larger studies, when we have the statistics and so on. But there is, of course, in the contribution of medicine, I can, if you like, I think Professor Sharif would decide actually to make a different lecture on Islamic contribution to medical knowledge. That I think is separate from this, which I devoted only to medical ethics today. So I think there is certainly some kind of research. It's not, as I said, in the formal way we practice it nowadays, but I think there is evidence for that.
Jazakallah khair. Akhi, we have a question said, what are the two elements of traditional Islamic medical ethics ought to be introduced back as a priority into secular modern medicine or medical ethics medicine, in your opinion?
Yeah, I think number one, I think we have to ask for itqan, being perfectionist. This is very important for every Muslim physician, nurse, technician, etc., to do his job in the perfect way. I think that's number one. And there is hadith for that. إِنَّ اللَّهَ يُحِبُّ إِذَا عَمِلَ أَحَدُكُمْ عَمَلًا أَن يُتْقِنَهُ. If somebody does anything, I mentioned that in the lecture. I think that's number one. Number two is actually to take the medical education to the best, to follow up what is going on in the West and translate that into Arabic. And I am a great supporter of teaching medicine in Arabic. Without that, I think we cannot grow up. And every country, most countries in the world, teach their medicine in their language. Israel teach in its language, Holland, and so on. Everyone. except for, unfortunately, the Arab world. So I think that's an important point, is to get, in fact, this into the practice of teaching, in addition to the English language, not to ignore English language. And we've seen the Professor Sharif in front of us, Dr. Najjar is there, everyone. We all actually learned in Arabic, and we can talk English. We actually caught up with the Western medicine, and alhamdulillah, all of us managed to do well. So I think this is actually as another important thing.
Another question from our beloved brother, Dr. Abu al-Bara, Dr. Radwan Khayyat. He just put in question, there's a very strong push in the world now for the euthanasia and the mercy killing. So what is the Islamic view on this, Akhi?
Thank you very much. I think we published actually this paper on euthanasia in your journal, Journal of British Association, Medical Association, Islamic Medical Association. I think I put clearly all the Islamic views on euthanasia. Euthanasia is totally forbidden in Islam. There is, I think, nothing that you have to kill yourself. I think there are things which in fact are allowed, like giving medicine, like morphine and so on, to relieve pain. And even if that actually lead to, let's say at the end of the day, to respiratory suppression, but that's not the intention of the physician. It is actually a practice to give, to relieve the pain, but only in the doses which are given according to the standard of practice. But if the patient at the end of the day, after years or months or whatever, reach a stage of respiratory suppression, that I think is the end of his life. But that's not actually something which is intended by the physician. So euthanasia is absolutely forbidden in Islam.
Dr. Radwan, do you want to add, do you want to shed light on this? Dr. Radwan, he's a consultant psychiatrist in Southampton.
Assalamu alaikum. Nothing more. No, I totally agree with the Dr. Hassan, and I think it's very good to have a clarity about it as a Muslim, because we will have a lot of pressure in different parts of the world to change mind, and I think it's driven sometimes by mercy killing or trying to take patient perspective. But I think if you permit this, gradually the circle will grow further and further, and more people will be either pushed or persuaded or under pressure to accept mercy killing. They see it as their duty to move on, to allow people because of the financial or burden on the society. And I think there will be degrading of life value, and that's not for Muslim, that's not for our ethical attitude. Thanks.
Absolutely. Totally agree. Thank you.
Dr. Sharif, تفضل.
Okay, Jazakallah khair. I think there's probably maybe room for one quick question. Almost finished now. One of the doctors here asking, what's the first Muslim university in the history that started teaching medicine and Islamic medicine?
In the history, in old history?
In the old history, teaching medicine for Muslim, obviously, the Muslim university.
Well, I think in the current era now, I think there are actually medical schools who are talking about or incorporating medical ethics, let's put it that, in their curriculum. Now, I think in Saudi Arabia, many universities incorporated medical ethics. Now, if we talk about Islamic medicine, or prophet medicine, I mean, there is difference between the two. We can talk about that in different lecture, but that actually is something else. And that is incorporated also in several universities in Pakistan, in Bangladesh, in different Arab countries. So it is incorporated nowadays there.
Yeah, Jazakallah khair. I mean, in general, one of the oldest university in the Muslim world, in Fas. I mean, obviously, this is just the history. I've got very quick comment from one of our colleagues, Dr. Muqdad Rawi. He's a consultant plastic surgeon in Newcastle. He just showing his gratitude at the great lectures, and he would love to invite you in some stage, inshallah, to probably maybe give similar talk in the British Association of Plastic Surgery, inshallah, in London. Barakallah fi. I think we're a little bit tight for time. Is there any more questions? Somebody would like to, you can raise hands, because we've got probably maybe chance for one more questions, please. Yeah. Dr. Muhammad Jamal.
Yeah, thank you very much. It's a great lecture, and we appreciate this type of lecture for us to be educated. My question I also posted in the chat, and there's another colleague, I think from also my country, if I understand, Somalia. And the first question is, if a doctor determines that a pregnant mother or woman in labor needs a C-section, does he or she need the consent of the patient only, or their family members, husband or father? As we understand is the norm, the latter is the norm in many countries. That's the first question. And the other question, which I think if he doesn't have, I will do it for him. What about if the patient family refuses, not the same case, resuscitation to peri-arrested or arrested patient? Anyway, what consent, whose consent is required?
You mean DNR, if the patient's been labeled as DNR, but the family refuse?
The first one is a C-section.
Yeah,
cesarean section, yeah.
Second one?
The second one, I'm just reading from the, I took the liberty to read it from the chat, where it says, maybe Muhammad Mukhtar can explain better. Thank you.
Let me answer the question. I think for the C-section, I think things in marital issues, it has to be consented by the husband and the wife, anything related to marital issues. But if there is actually an emergency situation, let's say, the husband is not there, you cannot wait for that. I think that is treated in a different way. But when we're talking about things which is not in an emergency situation, anything related to pregnancy, it needs to be consented by the husband and wife, because it is a mutual project. So I think it is both participating in that project. But emergencies are different way. There is actually a case where in some part of the world, a patient was not taken to dialysis because he is a little kid, and he was not taken to dialysis when he's in acute kidney failure, waiting for the father. That is not acceptable if it is life-threatening condition. So I think that has to be taken at that time as an immediate decision.
Jazakallah khair. I think he probably maybe met the second question, or maybe my understanding is, if it's somebody labeled as DNR, do not resuscitate, but the family has a different views, what's the obligation of Muslim doctors?
Yeah, here actually it is stated clearly that if the family refuse and the 3 competent Muslim physicians decided that this patient is for DNR, it will be left to the family to take the patient to another hospital. So they can have the option of taking their patient to a different territory to be managed there.
Jazakallah khair. I think we should probably maybe stop here, if you don't mind. Jazakumullah khair. I'm really sorry if there's any technical issue when we started. Inshallah, this fascinating talk will be recorded and published, inshallah, in our YouTube channel. the HIM-FIMA channel, inshallah. Jazakumullah khair again, Dr. Hassan. Barakallah. Great. It was honor really to have you today. Barakallah. Jazakallah khair.
Everybody waiting until this time, and that's on a Sunday afternoon.
Barakallah.
Thank you.
Jazakallah khair. Barakallah. Dr. Abdurrahman, maybe he would like to, I don't know, want to add a couple of...
Jazakallah khairan, Dr. Hassan, for your amazing talk. And mashallah, the interest from people is very high, and that reflects the importance of the talk. Can I ask all the audience, please, if it takes only like few seconds, I did put in the chat box the YouTube channel for HIM-FIMA, so we need to subscribe. So next time, inshallah, we will make it the streaming online on YouTube. It'll be easier than Zoom, but we need 100 subscribers in order to do this for future, inshallah. So if you just click on the YouTube channel and subscribe to that channel, so for future, inshallah, we can afford this service, inshallah. Jazakumullah khairan, and thank you very much, Dr. Hassan and Dr. Sharif.
Barakallah. Assalamu alaikum. Jazakumullah khair. Allah يبارك فيك. الله يقويك يا أخي.
شكرا حبيبي.
جعل الله مزال حسناتك. بارك الله. السلام عليكم.
السلام.